Exclusion of all animal food was associated with half the prevalence of hyperthyroidism compared with omnivorous diets. Fish from industrially polluted fresh water as the main source of organochlorinated pollutants and increased frequency of thyroid disorder. Excess androgens leads to the irregular periods or going for months without any periods at all, skin changes like acne, unwanted facial or body hair, and the male pattern hair loss.
Our next speaker will be Dr. Paawan Wadhawan.
So we talk about WFPB diet in PCOS, that is polycystic ovarian syndrome, and thyroid disorders. PCOS is the most common cause of female subfertility, with an estimated prevalence of up to 12% among women of reproductive age. And this line has a lot of meaning because I just studied yesterday AIMS literature that in India also prevalence of PCOS is in reproductive age group is 11.5, means out of 100 ladies, 11 are suffering from PCOS. This is a big number, and this number is also reflected in the world also. In the world, 12% of the women have PCOS. Its major characteristics include hyperandrogenism, clinical or biochemical, menstrual irregularities, and polycystic ovaries. A real issue in PCOS is excess of androgens, that is male hormones. Actually, it is perfectly normal for our ovaries to produce traces of androgens. They do not have much obvious effect because most of them are converted to estrogens, that is female hormones. But in PCOS, the ovaries produce extra androgens and the adrenal glands are also producing the androgens. This ends up with too much in the way of male hormones and they can cause problems. Excess androgens leads to the irregular periods or going for months without any periods at all, skin changes like acne, unwanted facial or body hair, and the male pattern hair loss. Polycystic ovaries, meaning enlarged ovaries with follicles surrounding the eggs. Now what happens when a lady is producing more male hormones? The fat distribution in that patient or lady will be also like males. So that male hormones, that is testosterone, this excess androgens change the body fat pattern of females. Ideally in females, the body fat pattern should be pear shaped. It should be more on the pelvis, but because of male hormones, it tends to end up at the waistline rather than on the hips and the thighs. Now this excess belly fat causes liver to become fatty, and fatty liver finally causes insulin resistance. What happens actually, there is to control our sex hormones, our liver is the main organ which controls the surge of sex hormones. It produces a protein called as sex hormone binding globulin, SHBG, sex hormone binding globulin. It controls the level of estrogens and testosterone. I mean, testosterone it controls in the men and estrogen it controls in women. So once your liver is inflamed, it is called as non-alcoholic fatty liver disease or NASH, that is non-alcoholic steatotic hepatitis. So once it is inflamed, it will not produce SHBG enough. Once SHBG is not enough, androgens become more active. And this vicious cycle, now more androgens, more belly fat, more fatty liver, less SHBG, more androgens. So this vicious cycle of androgen excess and insulin resistance keeps on hitting. Now this is the issue that between 30 to 75% of women with PCOS are obese, and women with PCOS often have excess body fat, particularly central adiposity, even in the absence of obesity. So obesity is not the criteria. You look at any lady who has been labeled as PCOS, she will have central adiposity. They will have different kind of fat distribution which usually should not be seen in the ladies. This is universal. This you will get everywhere. Over the long run, other problems can arise like infertility, depression, heart problems, and a higher than usual risk of endometrial cancer. And we have medical treatment options. They have their own side effects like OCPs, cause stroke or breast cancer, metformin, gold standard in reducing the insulin resistance. It causes bowel upset and B12 deficiency. Anti-androgens like spironolactone are given, and spironolactone any anti-androgens you all know they are tumorogenic or carcinogenic. Now the question arises, why the hell suddenly some ladies start producing excess androgens? It is the advanced glycation end products. This study from human reproduction addresses this answer, that advanced glycation end products might contribute to the etiology of PCOS and infertility. We have inflammatory foods, we have non-inflammatory foods. Inflammatory foods means which are actually arachidonic acid, full of advanced glycation end products. What are these advanced glycation end products? These are those unstable molecules which produce a lot of oxygen-free radicals in the body. Actually, what happens is, food is there, it is like a samagri, and body is like an engine or havan kund. You put samagri, if the combustion is proper, make our air more healthy. If combustion is not proper, it will give more smoke. Smoke will come. So you eat plants, you eat fruits, it is a very good quality of samagri. You put it into the fire, air will become purified. Your body antioxidant level will go high. Animal food, you put processed food, you put fried food. These foods actually have a lot of advanced glycation end products. These are those molecules which are very difficult for the body to do complete combustion. Body cannot burn them fully. So once they are not burned properly, smoke comes. Is oxygen-free radicals. This study, dietary advanced glycation end products and their role in health and disease. Over the past 2 decades, there has been increasing evidence supporting an important contribution from food-derived advanced glycation end products to the body pool of advanced and therefore increased oxidative stress and inflammation, processes that play a major role in the causation of chronic disease. Means food has got a lot of advanced glycation products, it goes into our body also get advanced glycation end products. Advanced glycation end products means more oxygen-free radicals. More oxygen-free radicals means more inflammation. So this study they have found. Now what happens? Increased levels of serum advanced glycation end products in women with PCOS. You can see clearly advanced glycation end products in the normal ladies was 5 and they studied in the PCOS group it was very high. P-value statistically significant. These data clearly demonstrate for the first time that PCOS women without overt hyperglycemia have increased advanced glycation end products level. Actually, these advanced glycation end products, where they will act in the body. They will act in the body at that place which has got the maximum receptors. So for advanced glycation end products, you have receptors called as RAGE, receptors for advanced glycation end products. And RAGE is most concentrated in ovaries. RAGE सबसे ज़्यादा कहाँ है? Ovaries में. Starts eating fried diet or animal diet, straight away first effect which is going to come in her is she will develop PCOS. Immunohistochemical localization of advanced glycation end products and their receptors, that is RAGE, in PCOS and normal ovaries, and they found that RAGE was not only highly expressed in PCOS tissues but also in normal ovaries. Means ovaries are actually highly concentrated with RAGE. Dietary advanced glycation end products and their role in health and disease. Foods rich in both protein and fat, mostly of animal origin, and cooked at high and dry heat, such as in broiling, grilling, frying and roasting, tend to be the richest dietary source of AGEs, whereas low-fat, carbohydrate-rich food tend to be relatively low in advanced glycation end product. And this is from American Society for Nutrition. You can see French fry has got only 694 advanced glycation end products compared to a beef which is fried has got 9,522 advanced glycation end products. Roasted chicken little less, beef which is broiled highest, lamb broiled again high, salmon high. Means it is much good rather than eating even if you look boiled beef has got 6,736 advanced glycation end products means if look into this data, it is much better to eat a French fry compared to a boiled beef. And the power of whole food, plant-based diet. If we eat WFPB means it is not veganism, it is veganism minus oils. Boiled potato, almost zero. This is WFPB. Impact of dietary modifications of advanced glycation end products on the hormonal and metabolic profile of women with PCOS. They put the ladies this was the diet, standard American diet which people were eating. It was a normal American diet, and their oxidative stress, insulin resistance, testosterone, advanced glycation end products, BMI was this one. They put them on a hyper advanced glycation product diet, means they gave them more fried, more pizza, more fried, and all these levels increased, and then they were put on a low advanced glycation end product diets synonymous with WFPB diet, and you can see their oxidative stress raised, went from standard American diet to hyper glycation end product diet to hypo glycation and hypo AG's diet. Everything reduced. Oxidative stress, HOMA-IR, testosterone, AGs, BMI almost same. Because why BMI same? Because this study was only for a period of 2 weeks. So this is the remedy for WFPB. Majoram, a type of oregano, ajwain. The effect of majoram tea on the hormonal profile of women with PCOS, a randomized controlled pilot study. And you can see the results obtained in the present study show the beneficial effects of majoram tea on the hormonal profile of PCOS women because it was found to improve insulin sensitivity and reduce the level of adrenal androgen. Intervention group, placebo group. They gave at the baseline testosterone. This is the dihydroepiandrosterone, which is the adrenal testosterone, and this is the fasting insulin level. At the baseline it was 9. They gave them majoram tea for 2 weeks and it came down. Fasting insulin level also came down, but nothing happened in the placebo group. The observed beneficial effects of majoram tea may justify the improvement claimed by the traditional medicine practitioners and patients. Prevalence of hyperthyroidism according to the type of vegetarian diet. Exclusion of all animal food was associated with half the prevalence of hyperthyroidism compared with omnivorous diets. Our findings indicate that participants consuming a vegan diet had a 52% lower odds of prevalent hyperthyroidism compared with omnivores. Observations by Trowell 5 decades ago indicate that in rural sub-Saharan Africa, consuming a near-vegan diet, a number of autoimmune disorders were almost rare or virtually unknown, including RA, type 1 diabetes, thyrotoxicosis, and Hashimoto thyroid diet. Consuming whole plant-based foods is synonymous with an anti-inflammatory diet because there are various mechanisms like animal foods contain more estrogen, causes autoimmunity in the cells. Vegetarian diets are having more amount of antioxidants which are possible protective factors against the autoimmune disease. Vegan diets may downregulate systemic IGF, which is again a precursor of autoimmune disease or cancers. Polyphenolic phytochemicals such as flavonoids found in plant foods are thought to protect cells against autoimmune process. This study from toxicology reports showed that the indirect effect and biomagnification of pesticides in food chains results in unpredictable negative consequences on thyroid health. This all of you know because anyway you eat more up in the food chain, more pesticide exposure. More pesticide exposure means your body has more levels of non-biodegradable substances which will affect your health. And fish, this is from Science Direct, fish from industrially polluted fresh water as the main source of organochlorinated pollutant and increased frequency of thyroid disorders and dysglycemia. Means fish is one of the culprits, so avoid fish-based omega-3 supplement. Dietary factors associated with plasma TPO and thyroglobulin antibodies. Now what happens is we go to the doctor, you get hypothyroidism, doctor will advise you to get done anti-TPO levels. Very frequently test done, and you get Graves' disease, they will tell you to do thyroid globulin antibody. This is one of the way you monitor the activity of the disease. More TPO, more inflammation, more Hashimoto. more now how to tell that Graves' disease will go into remission or not, or you are improving or not. You measure thyroglobulin antibody levels. If they are decreasing, you can taper off the drugs like neomercazole or methimazole. If they are taking, they can be reduced if your thyroid globulin antibody levels are improving. And this study, they looked what dietary factors are associated with plasma TPO and TG level, and conclusion is surprising. The dietary group with frequent consumption of animal fats and butter was associated with positive plasma TPO antibodies or thyroglobulin antibodies, p-value statistically significant. The dietary groups with frequent consumption of vegetables as well as dietary group with high consumption of dried fruits, nuts and muesli were associated with the negative findings of TPO antibodies and thyroglobulin antibody, p-value quite good. Recent papers evaluated the microbiota composition in fecal samples of patients affected by Hashimoto thyroiditis, and studies agreed to identify a clear reduction in the concentration of Prevotella 9 in subjects with Hashimoto thyroiditis independently from the thyroid function status. Now, what is that Prevotella 9? Prevotella is known to enhance the anti-inflammatory activities by reducing T helper cells polarization and promoting the differentiation of anti-inflammatory T-regulatory cells at the intestine levels, or you can say more and so Prevotella is a kind of good bacteria with anti-inflammatory properties which is found in plant-based diets and reduces the inflammatory processes in our body. Moreover, decreased Prevotella levels have been reported in diseases such as multiple sclerosis, autism and type 1 diabetes. Prevotella prevalence is considered as a beneficial bacteria in connection with the plant-based diet, and the animal-based diets invert the vegetarian's Prevotella to bacteroids ratio, causing the bacteroids to outnumber the Prevotella by day 4 of the animal-based diet. Means you put a plant-based diet person on animal-based diet, his Prevotella ratio decreased significantly just by introducing an animal-based diet in 4 days. If you are eating a plant-based diet, prevalence of hypo and hyperthyroidism will be very less. And how to treat? Again, you have to give remedies, and remedies which are very effective. Specific supplements for Hashimoto thyroiditis: Kala Jeera, the black cumin seed. European Journal of Integrative Medicine. Nigella sativa, the black cumin, treatment and serum concentrations of thyroid hormones, transforming growth factor beta and the interleukin 23 in patients with Hashimoto thyroiditis. And just 8-week treatment with black cumin significantly reduced TSH hormone levels, reduced significantly anti-TPO antibodies in patients with Hashimoto thyroiditis, and such changes were not observed in the placebo-treated. Serum T3 increased significantly after the treatment, p-value quite good, and there was a significant reduction in the body weight after treatment with 1 teaspoonful of cumin powder twice a day, and this is very effective. And studies have found that selenium supplementation and its effects on the antibody titers in patients with Hashimoto thyroiditis. The conclusion of this study was in patients with autoimmune thyroiditis, selenium supplementation may be effective in reducing the titers of thyroglobulin antibody and TPO antibody, which means selenium supplementation is actually very good for Graves' disease as well as Hashimoto thyroiditis. But we have a more effective whole food plant-based thing, and that is Brazil nut. It has been proven in many of my patients, they start Brazil nut, their thyroid dose goes down, their TPO level goes down, and they feel energetic. And to our surprise, Brazil nut is also a very effective treatment for hypercholesterolemia, means dyslipidemia. It reduces LDL level by more than 40 in 1 month of period, which is, I think, as equally good as giving somebody atorvastatin or rosuvastatin. But mind it, don't take it because it is very tasty. Those people who you will like it, it is like a rajma, and the taste is like peanut and very tasty. Don't eat much. 1 Brazil nut daily to avoid selenium toxicity, because case reports are there where people have taken too much and there was a toxicity. So this is my talk, and thank you so much for your patient listening.